cardiovascular system. So overview regarding cardiovascular system. Cardiovascular system is a very wide topic. It has several ramifications, and we are going to learn about basic things as far as final year is concerned. You guys, you should know about basic things about cardiovascular system. Okay, so ECG is one of those you have to know about normal as well as abnormal ECG. Then ischemic heart disease is also a major topic. Then heart failure, it's also a major topic. We will cover all one by one. And hypertension and congenital heart disease. So these are major areas which we are going to cover in within next 2 weeks. And in evening, there's a lecture on Monday, which is solely for cardiovascular examination system. So history taking, how to approach patient with the cardiovascular system illness, and how to do the cardiovascular system examination in that patient, how to proceed with patient with cardiovascular system disease. So in the evening, so every Monday. So today, our clinical examination portion is concerned. So we are going to know about what is history in patient with cardiovascular system illness. So we have to take. You have learned about the history taking in third year, fourth year, in final year. Unfortunately, we are off from campus, but actually this is the real life scenario. When you see real patients and take history from those patients, then you learn more things. But this is the online, so you can have little bit know-how about how to proceed with patients having cardiovascular system illness. So history, you have to go systematically. You have to ask all things from the patient. You have all portions of history taking as you are doing in your clinical rotations in different areas, in different subjects. So first of all, you have to, and it depends upon the circumstance. You are looking for patient, whether you are in outpatient, you are in clinic, you are in emergency department, whether you are in ICU, CCU, or ward. So it depends upon the circumstances in which you are going to look. You are receiving patient. Okay, so emergency scenario is different. Clinical scenario is different. If you are sitting in clinic doing outpatient department, then you have different scenario. So first of all, the general look of the patient is very important. So if you are sitting in OPD and patient is coming to you, um, you you have a general impression of the patient, whether patient is sitting on wheelchair, patient is coming by himself or herself, or he is needing any type of support, or he is on a stretcher, or in patient whether he is able to talk or not, able to have a conversation with you or not, you are shaking hand, then you can also have a lot of impression regarding illness. Okay, so this is the general look of the patient while you are receiving patient. If you are in the emergency room, you can have patient sitting on the bed, sitting in the chair, or he's lying in the bed. Okay, so you look on the patient. You can have assessment of the general condition of the patient, whether there's a oxygen attached or not, whether any drip is going or not, if patient is catheterized, patient is having intubated or something non-invasive ventilation is attached. So this is the criteria, this is the general impression a patient of patient when you are going to see in an emergency room. Similarly, patient is sitting in the ward, patient is in the ICU. So there are different scenarios, different situations, different circumstances in which you have different assessment of the patient. Okay, so this is the general survey, general assessment. Then you, when you receive patient, when the patient is sitting beside you, you have to introduce yourself. First of all, don't ask from patient that what is your name, how old are you, or you are starting biodata. But before that, you have to introduce yourself that I am Dr. XYZ, I am a student and I'm here. I'm also involved in your care. So I want to ask, I want to take history and physically, I will do your physical examination. So you have to introduce and you have to take permission from the patient. So whenever you are going in wards, in emergency, or you are sitting in the OPD, respect patient's autonomy, respect patient's privacy. This is the basic ethics you have to learn while you are doing things. You have to take care of all these things. Okay, so you have to be careful regarding patient privacy and autonomy. Patient respect is very important. So, and then you start with the biodata regarding of the patient. So how old are you? What is your name? Where from you? Are you coming? You know, so this is the what is your weight? What is your height? So this is the biography and biodata. Area of living. What is your occupation? So this is uh, biodata. After biodata, you have to go ask regarding presenting complaints. Presenting complaint in patient with cardiovascular system illness, patients coming to you in OPD and ER, what are these symptoms with which a patient can present? Anybody can comment. So, so try to speak in words in which patients they are going to express. So patient can, yes, someone has Yasser Latif has written retrosternal chest pain. So patient will come to you and he or she will tell you that I'm suffering from chest pain. So typically the patient they don't speak medical language, medical jargon, but they
छाती में दर्द हो रहा
simply express in simple words that I have got chest pain, and they will put their hand on the chest. Okay. Someone has written shortness of breath. Yes, this is also a symptom of having patient with chest pain or any cardiovascular illness. SOB, diaphoresis, central sinuses. So this is sign. Patient will present with sinuses. Now you have to, the doctor have to decide whether it is central or peripheral. So patient will present with bluish discoloration of the skin or appendages. Okay, so bluish discoloration is called cyanosis. When oxygen is desaturated, your blood is desaturated. Okay, so what are the palpitation? Good. Someone else. You can present with palpitation. Okay, so you have to write presenting complaint in the words of patient. What is patient is telling you, you have to write. Okay. What other thing which is important while writing presenting complaint, while listening to patient. What is the other important thing in case of presenting complaint? So one is chronological order. What is chronological order? Sometimes patients come to you and they have more than one symptoms, more than one complaint. So you have to write the complaint first, which appeared first, such as a patient has come to you with shortness of breath for 2 years, okay, chest pain for last 2 months. So which complaint you have to write first?
Shortness of breath.
Anybody? Which occurred first, okay? A patient who has symptoms of shortness of breath for last 2 years. So you have to write first the shortness of breath for last 2 years, then chest pain for last 2 months. Now you have shortness of breath. And what other second thing you have to write down the duration with presenting complaint.
2 years.
Okay. What is the next step in history taking? You have written your presenting complaint. Now, what is the next step?
Pulse history.
HOPC. Okay, history of presenting. So, what are the things you have to elaborate in history of presenting complaint?
Pain की history लेंगे. Socrates.
Such as shortness of breath or chest pain. You have written if patients coming to you with chest pain and shortness of breath. So what is history of presenting complaint of shortness of breath? How will you write? How will you elaborate? Okay, one is onset. Since how long you are suffering from this complaint? So this is duration, and then onset, whether it was acute or you have noted over time. So onset, acute or chronic. So there are different time duration for they are decided for chronic and acute illness. What is the severity? Okay, severity, whether it is mild, moderate, severe, or if you are describing shortness of breath, then what is the severity of SOB? You can have various other methods to describe the way you describe SOB. So if there's a pain, then what are the 5 things you have to look for pain? Number 1, sight. Where do you feel this pain? Whether it is in the whole chest or it is at the single point, or you can not tell about it. So this is the sight. Then again duration is first, then you have to describe sight, then the onset, whether it is acute in onset or chronic, whether it is continuous or it is on and off, intermittent chest pain. So character, what is the character of chest pain? What do you mean by character? Character means how do you feel that pain? Whether it is pressure type, whether it is stabbing, that is breaking, okay, or what type of pain you can have describe it. So patient tells you that it's a crushing, or someone has placed a heavy thing on my chest, or someone is squeezing my chest, or someone is stabbing. So it feels like someone has stabbed me. So there are different character of pain. So usually the chest pain with acute myocardial infarction, it is of heaviness type, or it is crushing type. Okay. So what is the radiation?
Vision radiating.
What do you mean by radiation?
Radiating.
So the pain which is inside our body, there are a lot of viscera. So visceral pain usually it is not localized, but it radiates to the areas which have common nerve supply.
Mm.
Okay, so patient who has got chest pain due to acute myocardial infarction, that pain will radiate into the area which are
Yes.
supplied by the
Yes.
same nerve. So medial side of the arm, it will propagate. It will propagate to the shoulders. It can
Neck.
radiate to either shoulder, either left or right. It can radiate to the neck. It can radiate to the jaw. It can radiate to the ear lobule. It can radiate to the back. So this is the typical radiation is present in pain with myocardial infarction or angina. Okay, so this is the radiation. Radiation occurs when there is a problem with the viscera, internal organs. If you have pain on the peripheral areas of the body, such as arm, legs, at skin, you can localize that pain. But if you feel pain in the internal organ, then it's very difficult to localize that pain. So this pain it radiates to the areas which have common nerve supply. So radiation. What else? What would you look in that patient with chest pain?
Aggravating.
What are the other things except radiation? Yeah. So how do you get relief from this pain? How do you get relief from this pain? Whether and how this pain comes, how, what are the association, what are the factors which aggravate this pain?
Mm.
Okay, aggravating relieving factors. So usually the pain with angina, it aggravates with exertion, or any type of the any type of the stress which causes increased cardiac output and which causes increased demand on heart, any fright, flight, or fight response, or any exercise, any exertion, if he um, carries any heavy object, then he can feel pain. Okay, so chest pain usually comes with exertion. What are the relieving factors? So you'll ask the patient how your pain get decreased. How do you feel relief from this patient? What maneuvers, what do you do when you have chest pain? So rest or drugs. Okay. So heart pain, chest pain, anginal pain usually get relieved with rest. They will give you typical history that when I exert, I get chest pain while I rest, or I stop I feel relieved within minutes. Okay, and if I don't get relief, then I use sublingual nitrates. So they give typical history. So this is the relieving factors. You may have chest pain with the stomach upset, any, and that pain will get released with antacid. You see, lot of patients they go to the general practitioner and they get BPI antacid and they get relief from the pain which is in chest. So chest pain, it is not always due to heart. There are several other things from outside inside. You go, you can have muscles, so muscle spasm can cause chest pain. You have bones, so any abnormality in bone that can give rise chest pain, pericarditis, perichondritis, and then you have lungs. So pleuritic pain, you can present pneumonia, you can have pulmonary embolism. These are the things which are other than MI. So there are lot of conditions which give rise chest pain. Esophageal spasm that can cause chest pain. What else? There are different syndromes which can cause chest pain. Aortic dissection. So the patient comes to you with chest pain, you have to look for any any lethal or life-threatening condition. You have to rule out. What are the lethal or life-threatening conditions in patient with chest pain? Acute myocardial infarction, pulmonary embolism, aortic dissection, okay, and what else? Tension pneumothorax, okay. So these are four things which are very urgent and they need emergency approach, okay. So you don't have time. If patient present with tension pneumothorax, myocardial infarction, pulmonary embolism, or aortic dissection. So all these things you have to go rapidly and you have to evaluate patient. Okay. So this is the cardiac tamponade. It is patient don't present. Patient usually they present with SOP. A patient has cardiac tamponade. Okay, patient who have any chest injury, he can present with chest pain as well as cardiac tamponade. A patient who made an accident and then rushes to ER and he has chest pain, you can find patients with cardiac tamponade if there is any tear to aorta or any vessel, any injury to the heart that can lead to cardiac tamponade. Okay. So what else you look? So you have to have a list of differential diagnoses in patient who present with chest pain. Okay, so not all patients who present with chest pain have MI. Okay, MI patients can present with chest pain, but there are a lot of other presentations uh, of patients having myocardial infarction. So what other symptom we have been discussing, that is shortness of breath. Okay. So shortness of breath, you have to go for elaboration of all the things which we have discussed in chest pain, such as what is the duration of shortness of breath, what is the onset, how does how does it get worse, how does it get relieved, and what are the associations, what are the relieving factors, how does it get relieved. So same, what is the severity, and along with that, patients with shortness of breath, you have to ask for any fever and cough and sputum production. Then sputum production, it means there is a infective element. If patient is present with the sputum, okay, and then shortness of breath. You can have a patient with orthopnea. You can have patients with PND. So these are the typical features of shortness of breath with heart failure. Patients having heart failure and they are having shortness of breath, then if patients having functional class 3 to 4, they can present with orthopnea and PNB. So this is the typical features of heart failure. Orthopnea and PNB both are typical features. A patient who comes to you, he says that I have sputum production, I have orthopnea, I have PND, then you have certainty that patient might be suffering from heart failure, as well as he may have something else such as pneumonia. Pneumonia, because patients can present with more than one illness of more than one system. So patient can present with epigastric pain, patient can present with um, chest pain, patient can present with pneumonia at the same time. So multiple issues can present in patient having chest pain or shortness of breath. So you have to look patient as a whole, not as a single system. Are you concerned with cardiovascular system? Cardiovascular system is not a single isolated system. It is interdependent with the. It is part of the body, and you have to look whole system, whole body. Sometimes, if a lot of patients they present in ER with hyperventilation syndrome, young females, they don't have any illness, but their psychiatric or some nervousness or some anxiety disorders, they bring these patients to the emergency room. So you don't have to treat your cardiovascular system, but you have to treat the the problem of anxiety and neurosis. Okay. Uh, so we are going to end this meeting within 6 minutes, and tomorrow your class is recording ECG, normal ECG, and abnormal ECG. Uh, in history taking and a clinical examination. Hopefully on Thursday I will bring PPT for you, in which we can have further detailed history and examination. Okay. Someone has written Mohammed Kumail. When will we label MI after onset of angina? So angina and MI both are related to the atherosclerotic cardiovascular disease, but there are they are at different end of spectrum. So one end is acute MI, in which your artery is 100% closed. This is acute MI. If you go for less severity, if patient has got atherosclerotic cardiovascular disease and he has got 70% blockage, 80% blockage, then that patient has pain due to exertion and it is called angina. Maybe he has resting pain, but it is called angina. But your blood supply is going, it is not enough to meet the amount of heart. So heart tells you that I am not receiving enough blood to meet my oxygen demand. So this is angina. But if patient you cut blood 100% to the artery and that area of the heart, then that heart area now it is suffering damage. Nowadays, it is having infarction, that is called myocardial infarction. So if patient is having occluded artery for more than 15 minutes,
मेरा
then he
तेरा
15 to 20 minutes,
मी
then he will suffer cardiac damage.
न्यूज़ लगी
And when you
एक ही लगी इब्राहिम को
when
पता है ना
you
डबल चला
measure cardiac biomarkers in
डबल
myocardial infarction, they will be
रिकॉर्ड होने
raised
लगी
in angina.
इब्राहिम
There
को
is
मैंने
no
बोला
myocardial injury,
इब्राहिम
but
तो होस्ट है
patient
वो
has
अलाउ करता
got
है
inadequate blood supply. So this is called angina. Okay. Any question?
थैंक यू
You guys, you go and read. There are different books for clinical examinations, such as
मतलब
McLeod's clinical examination, physical examination, history taking, all these things, McLeod's, and there's another Hutchison's. Whichever book you like, you go read and bring your questions here, bring your ideas, new things here. We will discuss here, okay? And if anything which you don't understand, I will help you. I am more than happy to help you. Okay? So I am going to finish here. Anybody have any question? Please, please ask. Can you hear me? So दो से कितनी बजे तक होती है हमारी? चार चार बजे तक होती है। तो ये तो खबर हुआ। हाँ? 40 मिनट की होती है। अच्छा ठीक है सही है अभी तो आज के लिए काफी है इंट्रोडक्शन सही